How do you know if your joint pain is from instability, and what can you do about it? Hi, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine, where we are focused on treating your arthritis, tendinitis, injuries, and back pain without surgery. So let's say you slipped, you fell, you injured yourself, strained your knee or your back or your shoulder, and 2 weeks later you're still having pain. Frequently, that is a sign that you have instability in the affected joint. So a strain or a sprain generally means that a ligament that is supporting the joint has been overstretched, or maybe a meniscus or other soft tissue structure has been overstretched and possibly torn, now leaving that area less supportive than it was before. That means instability. So if you've had that injury a couple of weeks before and you're still having pain, likely you have instability from that injury. But now let's say you haven't had a recent injury. Maybe you've had an injury in the remote past, or maybe you don't remember an injury, but you notice you have some symptoms. What are some of those symptoms that it could indicate that you have instability? Well, if you have pain that's occurring after activity, that could mean during activity, it could mean a couple hours activity. That generally means that the joint that is affected or painful is not being properly supported. That, by definition, means that it is unstable. Now, that could mean that, let's say, you have pain over the medial part of your knee. Well, it could mean that your medial collateral ligament is chronically slightly strained or sprained and not quite supporting that part of the knee properly, which is why you're having pain there. Other signs could be maybe you don't have pain, but maybe it feels a bit weak to you after activity, or you feel that it feels a bit loose, or that it may give out on you at times. It just doesn't feel as supported as it should be. That can frequently be a sign that some of the ligaments, meniscus, or other soft tissue structures are injured, not fully 100% working, and are unstable. Treatment for instability needs to be focused on improving stability. So that means utilize the options that we know are helpful and healthy for you. Certainly, initially it should be strengthening training, let's say physical therapy, to help strengthen the muscles around that injured area. If that's not enough, then you consider injection options. Steroid injections will not actually help to treat instability. They'll treat inflammation. They may actually make instability worse if you have too many steroid injections, because it can actually weaken some of the soft tissue structures. Gel injections can also help with some inflammation, but again, they don't actually help with instability. Treatments that can help with instability include treatments like Prolotherapy, platelet-rich plasma, and bone marrow-derived stem cells, where you can actually strengthen those ligaments, meniscus that's been chronically injured, so that the joint is overall stronger and more stable and functional. In more severe cases, let's say your ACL is fully torn apart, or your rotator cuff is 100% torn and the tendons are fully pulled back to the bone. In those kind of cases, surgery is likely needed to help to repair that and to provide more stability in that overall joint. Essentially, for really all other cases of instability, let's say partial tears or strains, in those kind of cases, your regen med options such as prolotherapy, PRP, and bone marrow stem cells are the appropriate next line option if physical therapy is not enough. Physical therapy can help with your muscle strengthening, cannot help to strengthen the ligaments. Regen med options can do that. So if you have instability symptoms, get checked out appropriately and get treated correctly.